Frank?
So I want to make sure that we kind of put everything in perspective, because blockchain is just one piece of the solution. So you have to really build around it. We talked a lot about data access and data interoperability. I don't think it's any mystery that we like to say healthcare lives on islands, but people don't. And I don't care what part of the world you go to, it's the same thing. I mean, a hospital locks their data away and it's in a silo and it's not very transportable, and add in political and geopolitical boundaries. The other thing about health, which makes it very unique, it impacts every person on the planet, regardless of your age or social economic condition. It's the one thing that it's important to everybody. And so let's keep that in mind. And again, data will move the needle in terms of cost and outcomes and access. And the part in terms of where it's fledgling, it can get overwhelming and overcomplex because of all the use cases. But then again, it can get very simple when you start coupling where the technology curve is going. Everybody in here is a publisher, right? We can go outside and press a couple buttons and a car shows up to pick us up. It's not that far away to where the light will go on. Maybe a light goes on at home and says, "Hey, it's time to wash my feet," or somebody's going to wash my feet or take my meds. We're not that far away, and I think that's what makes it really, really exciting at this point in time.
No?
I just make a comment really that we don't look at prevention, you look at treatment, and I think we need to take people's...
I'm just trying to establish if there exists already an application of blockchain which can increase the amount of time that nurses spend on nursing, or is there such an application that can be readily envisaged today, even if it's not already in operation?
I know you said specifically from a nurse's perspective. There's literally hundreds and now thousands of applications really overlaying on blockchain infrastructures. And so what we're talking about from the nurse's perspective is data access and understanding. And really, if you add some of the intelligence, it's kind of a prescriptive model. Hey, you may want to do this at this point in time. So it's an aid. It's an augmented intelligence or collaborative intelligence. And there are a ton of solutions being developed on that, utilizing underlying blockchain frameworks to provide attested data that feed those models. And we see some trials emerging definitely in the U.S. and some countries outside of the U.S. here in Western Europe doing just that. Driving cost out of the system from the standpoint of making the provider's the provider more efficient in terms of delivering care and taking away some of the administrative burden. So yeah, we have a number of those applications on our platform now.
Please.
Hello. Again, happy to hear about Estonia because we've been chatting with them for quite a bit. We have a private partnership with an Estonian company on digital ID. So coming to the point, actually the question is, don't we think that the real problem is on the ID, the sovereignty of the ID? Because I would agree with the intervention. Technology is a tool. So maybe for achieving a result in one situation, blockchain, in another situation is another technology. But the real issue is ownership of data, trust in the entity, the place where the data collected, and the ability to actually travel with your data. Because even in Italy, even in my own country, I cannot walk into the hospital and know that the hospital is going to know what I've done into another one. So down the line, there is a complete dispersion, a dissemination of our data, which is creating problematics in procedure. Like I was listening yesterday to a panel, and even banks on KYC, they say that they are spending something, I don't know how many billions, and it's always about the same problem, is how much paperwork we are doing to guarantee the quality of the service. And I always go back to, it's important that the data collected in a proper way, and somehow they're owned by the people in the way that they can walk into a place and just say, this is me, what can you do for me? It would be interesting to know whether this angle will...
I also saw Shada, I want to give the floor to Shada. Use this because I think this is a central point. Maybe we can use this for our closing statements and just have the entire panel make the final point they would like to do.
A couple points. One, I think identity from a person perspective will be the first large-scale adoption of blockchain. And when you extend it to health, you know, our health information becomes an extension of our identity, and becomes attached to us. We build our own health profile around that data, and it's that data that allows you know, better quality of care, more personalized care at a lower cost. So I think that's an important thing, and it also makes it transportable. When we talk about the technology itself, let's not forget that blockchain is a result of 40 years of cryptographic research. So Peter mentioned Merkle trees quite a lot. That's part of that cryptographic research. It's an element of most blockchains from the standpoint of some of the legacy technology, but it's technology. It's going to evolve. It's going to change, and as it matures and progresses, you're not even going to know it's there. If you know, as we begin to adopt it, it becomes transparent. Just like you don't know how, you know, what most people in this room probably don't know what TCP/IP is on the internet. It was a big deal quite a lot of years ago, and it made the internet what it is. Blockchain is going to make data transportability, you know, a commonplace thing, transparent to most of us in the world. It's not going to be that difficult. Right now it's hard, but you're going to see over the next 5 to 10 years, it's going to blend into the background, and you're just going to see a whole bunch of really cool new capabilities emerge within the health space. And let's not forget that 99.9% of our life or more is lived outside of the clinical environment. And all that information about what we're doing and how we're living is important to our providers as well. So it's going to, you know, think blockchain not as replacing existing systems, but building that connectivity tissue with all aspects of our life.
Paul?